and welcome to myTRIAList. Today, we will provide an overview of the STELLAR-305 study. STELLAR-305 is a clinical study that is exploring a new combination of cancer treatments for patients with recurrent or metastatic head and neck squamous cell carcinoma that is positive for a marker called PD-L1.
What is recurrent or metastatic head and neck squamous cell carcinoma?
Head and neck squamous cell carcinoma is a type of cancer that starts in the lining of the mouth, nose, throat, or other parts of the head and neck. Recurrent head and neck cancer is cancer that has come back after initial treatment. Metastatic head and neck cancer is cancer that has spread to other parts of the body, like the lungs, liver, or bones.
What does it mean for a cancer to be PD-L1 positive?
PD-L1 positive means that the cancer cells have high amounts of the PD-L1 protein. When cancer cells have high amounts of PD-L1, it puts the brakes on the immune system and stops the immune cells from killing the cancer. Cancers that are PD-L1 positive may benefit from treatment with specific immunotherapy medicines.
Now that we know more about PD-L1 positive, recurrent, and metastatic head and neck squamous cell carcinoma, can you tell us about the new combination treatment being studied in the STELLAR-305 trial?
STELLAR-305 is testing a combination of two different cancer medications, zanzalintinib and pembrolizumab. Zanzalintinib is a new drug being studied called a tyrosine kinase inhibitor, or TKI. TKIs may slow the growth of tumors in people with some types of cancer. Pembrolizumab is an approved therapy for recurrent or metastatic head and neck squamous cell carcinoma. Pembrolizumab is a type of immunotherapy that helps the immune system fight cancer. Pembrolizumab blocks the protein PD-1 on immune cells, which removes the brakes, allowing the immune cells to do their job and kill the cancer cells. Researchers think that zanzalintinib and pembrolizumab can work together to kill cancer cells by slowing their growth while also helping the immune system recognize and attack the cancer cells.
Hi, my name is Nabil Saba. I'm a head and neck cancer medical oncologist practicing at Emory University, and I lead the head and neck cancer program at Emory University. The current standard of treatment, as noted, is essentially pembrolizumab or pembrolizumab and chemotherapy. And so one of the possible advantages of this combination on the trial is that people are avoiding the side effects of cytotoxic chemotherapy.
What is the goal of the STELLAR-305 study?
This study is testing whether adding zanzalintinib to pembrolizumab does a better job at stopping progression of the head and neck cancer and allow patients to live longer than if they were just taking pembrolizumab alone.
Can you explain how the study is set up?
STELLAR-305 is a randomized study, which means that patients will be randomly assigned to one of two treatment groups. One group will take zanzalintinib and pembrolizumab. The other group will take pembrolizumab, a common treatment for this type of head and neck cancer, and a placebo or sugar pill. This is a double-blinded study, which means that neither the participant nor the doctor will know which group they are in. However, the group receiving the placebo will still also get the standard of care treatment, pembrolizumab.
Whatever treatment the patient is getting, the treatment is going to continue as long as the patient is going to benefit from the treatment. We know, for example, that even with single-agent pembrolizumab, which is now a standard of care, that some patients will be very good benefactors of pembrolizumab. In other words, they may benefit from being on pembrolizumab for a very long time.
Researchers will then compare how well the treatments block cancer growth and extend the lives of patients, as well as understand any side effects.
Who can participate in the STELLAR-305 study?
You may be able to take part in this clinical trial if you are 18 years or older and have recurrent or metastatic head and neck squamous cell carcinoma that cannot be cured by localized treatments such as surgery or radiation. Participants must also have cancer that can be measured on a scan and that is positive for the PD-L1 protein. Although certain prior treatments for head and neck cancer are allowed, patients who have already received systemic drug treatment for their recurrent or metastatic cancer should talk to the study doctor to see whether they are eligible to participate.
If you are willing to consider yourself as one of the early benefactors of a possibly newly approved standard in the future, then a clinical trial is for you.
We hope this video helped you learn more about the study. Check out the STELLAR-305 study page on myTRIAList, where you can find the study contact in case you have questions or want to find out if you qualify for the study. Visit the myTRIAList Trial Finder to find the right study for you at mytrialist.org.